Well, good afternoon. I see a lot of friends and colleagues here, and appreciate the chance to come give my perspective on health informatics. And it's funny talking about the IAIMS. I didn't remember the acronym, but when I started in health informatics, I had worked for years at the hospital as an emergency and then informatics nurse, and had gotten a master's in informatics at our School of Nursing, and then was starting a PhD program at SILS. And then Dean Dr. Joanne Marshall and Carol Jenkins put together a symposium. Some of you may have been at that. It was at the Keenan Flagler building, talking about '99. And somebody came, Valerie Florence came from, I think she was at the University of Pittsburgh at the time. Later she went to the ALM and gave a talk on IAIMS. And so my start in health informatics really was, very naturally started from a library, an information science perspective, and so I was just thrilled to have, us again be partnering with librarians in the health science library in particular as we developed our CHIP program, because to me it's a natural fit, and with library and information science being, such a prominent part of what the library of medicine does, in addition to funding some of us in our research. I think the possibilities are great for ways that we can collaborate. So I look forward to that discussion and to working with more of you. So I'm going to give you a bit of a perspective on health informatics. I do teach an intro course, so some of this is Health Informatics 101, which I understood was part of what they were interested in hearing today. So. And I'll actually be sharing some information from our professional society, AMIA, American Medical Informatics Association. So I see health informatics as a core bridging between the clinical world and the information technology world. And what I'll present to you today is a little bit on the scope and some terminology that continues to evolve in this field, and certainly in the time I've been in. Briefly describe to you what the School of Nursing's programs are in informatics education. And then I thought it might be useful to give you a few examples of people working in informatics who we train to send out and work in informatics in both the School of Nursing program and our interdisciplinary programs. And then I'll finish up with a list of some research projects in informatics. So these couple slides here are actually from AMIA. They're from Ted Shortliff, one of the leaders in clinical informatics, who at the time he gave his presentation at one of our national meetings was the title is the president of the AMIA, and I think it's a really nice way to view this big world and all the things that go under this umbrella that we call informatics, because I think it's a little bit confusing, and it all comes down to terminology, doesn't it? We all know about that. So this sort of shows going from the left side of your screen to the right side of the screen, talking first about the more bioinformatics-oriented areas of study and development that Ashraf also mentioned, starting at the molecular and cellular level, and I assume we're going to hear more about that from Brad. And that's where I view, and the way AMIA presented it, views bioinformatics, looking at that level, and then you can see clear on the other end of that continuum is population health, looking at patient data in an aggregate level and looking at communities, and that's really the realm of public health informatics. And then in between we've got imaging informatics, still again over on that more basic side, and what I view as clinical informatics, which is really the study of individuals and patients. And then you can see on the left side of your screen the vertical arrow starting with basic research and going to more applied research. The types of research that goes on in informatics is, as you can see, quite broad. I love our national meetings because you get all kinds of people there. It's not just a bunch of nurses or even a bunch of clinicians, and I learned as much, if not more, from folks from the other disciplines there. So you can see some of the major areas that are included in the building blocks of health informatics. Statistics, cognitive science, obviously very important for clinicians, and many of you have been working with folks over at the hospital right now. Some of them are in information overload with the EPIC system. We need some help with cognitive science. How much information can they process? And hopefully that's going to get better as they get used to that system, but we're hearing a lot of that right now. And then clear over to math modeling, natural language processing, and data mining. And I think David's going to share with us more about that area. So, and then database theory also. So you can sort of see the breadth and the top to bottom look at that. And then you can see here where the terms health informatics and clinical informatics come into play. So the broad term for our new program here, this PhD program we're developing, is biomedical and health informatics, but they're not actually the same thing, and I think sometimes folks do confuse those. Health informatics, as you see here, really encompasses those two on the right side of the screen, the clinical informatics as well as the public health informatics. And then the biomedical informatics would be the other side of that screen. So that's just one view for you that I hope kind of puts some of that terminology in perspective. You've probably also heard of these specialties: nursing informatics, medical informatics, dental informatics, public health informatics. Well, what I actually prefer to use, and I teach the students, is it's really no longer separate specialties doing their own thing in informatics. I'm not sure it ever was, but you know, when I started in this area, we heard about medical informatics, and then as a nurse, you know, I sort of put in the nursing informatics category. But in fact, most of the work I've done in informatics, particularly on the research end, is interdisciplinary work, and it doesn't really fit in either of those categories. So this is a newer term that we see more now: health informatics or healthcare informatics. And just a couple terms that have developed in the field. Informatician is one word used to describe those of us who work in informatics. I don't like that one. It sounds too much like mortician. I like informaticist better. You hear both out there, so these may be terms. These are just people like all of us up here who work in some aspect of informatics, health informatics in particular. These terms are used. I'm not sure they're used outside health. And just a couple misconceptions I like to share. A lot of people in the clinical world think that because I have informatics in my title, that I must be an educational technologist and like a specialist in online teaching. No relationship whatsoever, and I'm probably preaching to the choir here with you all. Nor do I happen to be an expert in networking and hardware. In fact, if anything, I'm way more on the Luddite end of things. The kind of research that I do doesn't require that kind of expertise. Now, some of my colleagues up here are, you know, accomplished computer scientists also, and we all fit under that umbrella, but those certainly aren't equivalent. And the academic preparation, some of these terms are from the slide you saw earlier from AMIA, but you can see the various academic preparation of people who work in informatics. The sociologists do a lot of studies of user acceptance of technology, and you know, there's studies looking at whether patients like having their clinician looking at the computer while they're in the exam room, and they do some great work clear on the qualitative end of things. And then we have, you know, very hardcore research in health informatics also under computer science, information science. We have biostatisticians who work a lot in the area that I specialize in, which is syndromic surveillance, which is taking emergency department data and monitoring it for trends in symptom data to look for disease outbreaks. And we have some very sophisticated, you know, models that the mathematicians bring and the statisticians bring to our world to help us look for noise within all, you know, the needle in the haystack, as it were. Clinical fields obviously are big. Ergonomics, another very important area, and then lots in public health. And then organizational behavior is another big one. And there's a couple people over at the School of Public Health right now in informatics and health policy and management who do informatics research looking at organizational issues such as adoption and quality and all sorts of things like that. As I said earlier, AMIA, some of you may remember back to SCAMSI, which was an earlier version of the same organization. I know you still have some SCAMSI proceedings here somewhere, but I don't know if they ever got digitized or not. I used to come over and pour through those books when I was in grad school. It's our professional society, and if you want a little bit more information about the breadth of kinds of research and policy and development work going on in health informatics, a good place to look is this link here, and I won't take the time to do it now, but it lists all the different working groups within AMIA, and they change as trends change, so it's a good way to get a flavor for the different kinds of things going on, as does this list of the current content for our intro course in healthcare informatics, which we teach through the School of Nursing right now. It's a part of these new degree programs that you heard about in our degree programs at the school. But we do open this class up to people from across campus, so very interdisciplinary. And here's some of the topics. And I can certainly see a lot of places where librarians could be involved. In fact, consumer health information here, I always mention NC Health Info as a wonderful example of a North Carolina iteration of consumer health information, you know, helping patients and family members find reliable health information on the internet, and that's certainly something that that you all know way more about than I do here. So I point them to your resources for that. In the School of Nursing, we've actually had an informatics presence for quite a long time. Since the 90s, we've had a master's program in informatics. It's in our healthcare systems division, so nurses can specialize in administration, outcomes, or informatics. And as part of the CHIP program in the last 3 years, we added a certificate program for nurses who already had a master's degree, but it wasn't in informatics, and they just wanted to get that informatics content. And then we're working closely with the CHIP program on the new PhD. We do have a PhD program now, and some of our students do specialize in informatics at the PhD level in our current program. But we will also be a part of the new program that's developing, and this professional science master's. One of the questions we're still trying to grapple with is it's somewhat similar to our own master's program, so we're going to be helping students decide which direction to go there, the professional science master's or the MSN, depending on what their career goals are. The professional science master's is a little bit more industry focused, and the master's in nursing is a little bit more focused on doing things like being able to teach in nursing, for which you need an MSN. And then we have another new program, the Doctorate of Nursing Practice, and we've actually just started that program this past fall and have our first informatics student in that area coming in. This is, if you're not familiar with it, it's similar to a PharmD. It's a more practice-oriented advanced degree for nurses, kind of a terminal degree. And typically nurses with that kind of a degree would go specialize in some non-academic setting in doing informatics. So maybe working in a hospital, working up through administration or something like that. There's national certification in informatics. We, in nursing, have a certification for years, and there's another list of content for some of the kinds of things that are studied and expertise in informatics. Actually, the certification is really more industry focused and not academic focused. So many places want to hire nurses in informatics jobs that have this certification, and so you can see what the common content areas are for that. Medicine has also recently developed a certification program for physicians. Their inaugural test was last fall, and we have several physicians here at UNC who are now certified in informatics, and they will be moving toward, is it actually going to be a residency?
No.
Just
yeah. I mean, they
subspecialty in medicine.
Yeah,
and they're boards.
If they're
they
boards.
sit for. Yeah, so it is a board certified informatics physician specialty that has just started. And Dr. Sam Seibert here in the School of Medicine is working with that division. Here's some examples of some of the kinds of job roles that graduates from our programs go out to do. Probably the most common one is called a clinical analyst, and when I was in the master's program, I met somebody doing a job like this, and he said he was an embedded analyst. He was a clinician who had informatics training, tended to work in a healthcare setting like a hospital, in the clinical setting, but closely with the IT people. And I like to tell nurses, if you like to translate, that's probably a good place for you, because the clinical people don't understand anything but the gray world, and the computer only understands the black and white and the ones and the zeros, and the person who can wear both hats can translate, because computers will only do certain kinds of things, and it often doesn't match the clinical world very closely. So it's a very interesting place to be, and that's where probably the majority of our master's graduates end up in a role like that. Chief Nursing Informatics Officer is a newer position that's coming out now. We also have a Chief Medical Information Officer. We have both here at UNC now. Many of us go on to research. Most of us go back for a doctorate to do that. And then many people who get informatics jobs or training also go into some kind of educational setting. And here's some of the different places that we have our nurses and nurse graduates employed, obviously in all the healthcare organizations, big and small. Consulting firms, that's another really big one. They love to hire nurses to go in before a system is selected, or as they're trying to implement one. They used a lot of consultants here at UNC to look at workflow and try to help take this computer that's black and white and ones and zeros and plop it down in these clinical environments with all these crazy workflows that didn't match what was going on in the computer, and help figure out how they were going to make that work. And if you don't do that, then what clinicians tend to do is workarounds, and that can lead to all kinds of safety and quality issues, which is another big area of research now, sort of the unintended consequences of health IT, very big area. Vendors, as I said, in universities. And then one last slide. Here are some of the major areas of research in healthcare informatics, and nurses end up working in all of these, and so do most of the other groups represented here today, and in our other partner schools such as public health, everything from consumer health informatics, computerized decision support, standards, that's still a big one. There's still a lot of research going on in that area. Natural language processing and text mining is big, especially with all these notes we're now getting in electronic form, and all the clinical researchers are just salivating to get their hands on the data, but it's really hard to use that data in the form it comes out, even from the electronic systems, because they're not standardized. And there's phrase builders in most of these systems, so you get some really wacky phrases that are in there. And so there's, I think, for a long time, going to continue to be a need for NLP and text mining to make that data useful. Telehealth and telemedicine, and I know AHAC works on some research in that area here at UNC. Some of you may be involved in that. Another big area is the mobile devices and all the apps that are available. They call that mHealth. Study, how to motivate people to exercise after colon cancer through, a mobile device. There they upload information. That's an exploding area of research. People and organizational issues. That whole change management thing continues to be a challenge. I was impressed with everything Epic did. It was pretty textbook when they came in, but I still heard lots of complaints from people on the front lines about, gosh, can't this fit better? Couldn't we have had, more customized training? So, there's still so much work to do in that area. Public health informatics is the area that I ended up sort of falling into. Around the time of 9/11, more and more electronic emergency department data was becoming available, and public health suddenly became interested in following disease trends, specifically looking for bioterrorism attacks, which we've never detected one because that's a very rare thing. But we've ended up developing, sort of general purpose public health surveillance programs using data from electronic health records such as emergency department data. And then the unintended consequences of clinical systems. And there's a link here. I guess they're going to see these slides. This can be posted later. Every year, one of the leaders in informatics at the National AMIA meeting does a year in review and sort of reviews the hottest research that's come out of the previous year in health informatics, and that's a link to the last AMIA 2013. He does that for every year, so it's an interesting way to look at trends. And with that, I'll stop.
Thanks, Debbie.